the state health plan is facing a big funding shortfall. And yesterday, the North Carolina Senate passed a fix for the funding shortfall, getting it needed money. Well, there are three major players in the state health plan. One is state workers. The second is Blue Cross and Blue Shield, the administrator of the plan. And third are the pharmacies and the pharmacy benefit manager, which manage the drug part of the state health plan.
Well, and they're all making money, right?
They're all making money.
Except for state
workers. They're paying the big premiums.
That's right. Okay, someone's paying, two others are making money.
And the Senate, instead of spreading the pain equally amongst the three players, really shifted all of the pain only to state employees and really let Blue Cross and pharmacists off the hook.
Right. We could really see the way that things work in the North Carolina Senate and the General Assembly in North Carolina a couple weeks ago. This was really a case study in how a powerful healthcare special interest, in this case the pharmacy industry, was able to come in and make changes in a bill that hurt taxpayers and that hurt state workers, but were very beneficial to that industry. You first saw this a couple weeks ago in a hearing the NC Senate had on this bill, where the only three people who spoke were all lobbyists from the pharmacy industry. Let's take a look.
There's 12 million prescriptions roughly in the state employees health plan. Between 33 and 50% of prescriptions, those maintenance prescriptions, of the 9 million prescriptions, will go to mail order.
Talk about every day is it's our interest in working with a plan to help them save
the very finest cost containment piece of the entire healthcare system is the personal relationship between the pharmacist standing behind me and the patient in the store.
So after that testimony, there was a lot of behind-the-scenes maneuvering on the bill. It was delayed several times, and when it was finally introduced on the Senate floor, there was an amendment offered.
There was
an amendment that made it easier on one of the three players.
Let me guess, it saved money for state workers, is that right?
Not for state workers.
No? Surely then Blue Cross Blue Shield had to pay more since it got a $100 million contract from the state health plan.
Believe it or not, Blue Cross escaped having to pay any more also.
Don't tell me it was the pharmacists.
The pharmacists are actually paying less, and state workers, as a result, in the amendment, have to pay more.
Unbelievable. This is how special interests operate. Let's take a look at the Senate floor debate.
It's the same bill that we spent all the time on. So I hope everybody's had their questions answered. If you have any questions, I'll be happy to answer, and I would ask your support. Thank you. This was rewritten at the request of the pharmacist. It makes it a little more favorable toward them. Sixth,
frankly, I can't believe that the North Carolina Senate is going sort of backwards on health reform. It just seems crazy to charge people more while you're protecting the biggest special interests in the state in health care. At the Health Access Coalition, we actually have several clear suggestions to save money in the state health plan and implement some reforms. One, we'd like to have even more stringent requirements on drugs, both from the pharmaceutical industry and pharmacists, so that we're saving money in a place where we know we can save money. We suggest a blue ribbon commission of some of the tons of experts we have in the state to look at how we could reorganize the state plan to address some of the structural problems with it. And we need to look at saving substantial money in the no-bid contract that Blue Cross got to administer this plan.
Well, maybe if we take a couple of those suggestions as opposed to what the Senate passed yesterday, we won't have to be here in 2 years trying to bail out the state health plan again.